I am Dr. Radhesham Nayak. I am a medical oncologist, hemato-oncologist and a bone marrow transplantation physician at Sammprada Hospital, JP Nagar. I have got about 25 years of experience in treating cancer patients. This International Women's Cancer Day, we want to celebrate it as a day to prevent these cancers. Preventing cancer is the best way to deal with cancer because cancer treatment is expensive. It can result in organ losses and a lot of side effects, and still the results are not predictable. So preventing cancer is the best way to deal with cancer, and 70 to 80% of the cancers are eminently preventable, especially the cancers in the women, which is head and neck cancer by chewing tobacco, lung cancer because of indoor pollution or even smoking, and uterine, ovarian and breast cancers. These are the common cancers in women, and most of these can be either prevented completely, which we call as primary prevention, or can be detected early and cured, which we call as secondary prevention. So if we combine both primary and secondary prevention, then about 80% of the cancers can be either prevented or cured, and another 20% of the cancers which are not detected early can be treated with modern facilities, and the prolongation of survival, good quality of life and symptom relief are eminently possible in this group of patients. Our hospital is a very small cancer center, boutique cancer center I can say, and a hospital of this size will never have a preventive oncology department. But we have invested in preventive oncology department, and also we have taken into our staff Dr. Vinod Ramani, who is a preventive oncologist. He is a community medicine doctor who has worked in oncology, and he is very active in our hospital. And we try to do preventive work individually, plus every cancer related day we celebrate and we do the specialized training, screening programs and training programs for our staff.
Hi, I'm Dr. Vinod, preventive oncologist at Sammprada Hospital. We are taking initiatives for screening for cancers. We have a lot of inpatients who have cancers here and who are undergoing many forms of treatment, including chemotherapy. So basically, we are looking at the relatives of those patients, and we consider them as high-risk group because siblings they share the genetic material from their parents, and they are genetically at risk. Because if one sibling has developed a cancer, it is likely that the other sibling is at higher risk for cancer. So for these high-risk groups, we are trying to mobilize them, and then we are trying to look at a few cancers: oral cancer, breast and cervical cancer, especially among women naturally, prostate cancer among men, stomach, colorectal cancer and lung cancer. So we are trying to focus on these cancers, and then we are looking at some of the markers. For ovarian cancer we have CA-125, for breast cancer it's a clinical breast examination, for colorectal cancer it's a fecal occult blood testing, for stomach cancer there are few. So we have a few tests like these, and which we want to implement it on the high risk group, and we are gathering more evidence on what are the best practices towards screening processes for the high risk group, and then we want to take it to the general population. But these screening activities will not say that look, you don't have cancer. So the probability that you may not have cancer is pretty high. So there's an iota of doubt usually, but it's always good to undergo periodical screening because cancer is a slow growing disease. So today if I screen you and say that you are not having cancer today, so it might develop in the next 6 months to 1 year. So periodically you have to undergo screening. So my recommendation is that you should be responsible for your health. It's not only for cancer, even for other chronic diseases like hypertension, diabetes, for mental health, for any disease for that matter. So consult your physician, have a dialogue, Focus on what best you can do to prevent diseases. Your diet, your physical activity, your mental health, your well-being. Think about your past, where you have come from, and then you can plan for a healthier future. And I'm sure that is the better way forward. Thank you.